actually lead to an elevated blood pressure. Now, does that person always have hypertension? No, not always. Home monitoring of blood pressure, particular syndrome that's been identified, because now your physician or your primary medical provider can hook you up to a little machine that will check your blood pressure continuously throughout 24 hours, and then you bring back the machine, it reads it out, and it sees during your normal activity and at rest your blood pressure is just fine. Or it may show the opposite. But this is a real entity that we have not so very long ago identified. Idiopathic just means we've ruled out everything here and you still have high blood pressure. So there's always that opportunity as well. Well, what are the benefits of knowing that you have hypertension and then treating it appropriately? Stroke is reduced by 35 to 40%. That's pretty good odds. Heart attacks or myocardial infarctions are reduced by 20 to 25%. And heart failure is reduced by over 50%. Those are pretty good odds for us in this day, aren't they? So, great reason to control our blood pressure. How do we do the diagnosis? Well, once we have checked our blood pressure appropriately on 2 or more occasions and see that it continues to be elevated to hypertension ranges, then we see our doctor, and the doctor will take a thorough history, including a family history. Does high blood pressure, hypertension, run in families? Yes, it does. Could it occur in any family? Certainly, because of causes. Remember, there's a number of reasons that somebody might develop hypertension. And then, after a thorough history, the medical provider will do a thorough, hopefully, physical examination. And it's very important because they need to check out the back of your eyes, make sure that looks healthy. They need to check out your thyroid gland, certainly need to listen to your heart and lungs, and make sure your heart sounds good, no extra murmurs, no other problems. And then check for masses in your abdomen or around the kidneys. And then, of course, check your pulses in your upper and your lower extremities. And then there will be laboratory studies, including checking what we call your electrolytes, your potassium, sodium, kidney function, blood sugar, and then also some other things like your liver function. And then there will be heart tracing. Also a urinalysis is why? Because they place violent disease. Individual finds they have a problem. They may actually be spilling protein in their urine. So after all of this is done, we have to say, okay, we've diagnosed it appropriately and we've done all the testing, and now we've decided that this is probably idiopathic, or we may have found another cause. Either way, the most important treatment is this: changing our lifestyle, making sure that just like the figure, that there is a good balance in our life. A good balance between work and play, stress and relaxation, fruits and vegetables and food, caffeine and water. Making sure that we have developed the balance that is necessary to keep us well. And that includes an optimum weight. Now, I put optimum weight because not everybody needs to be pencil thin. Agreed? Yes. In fact, pencil thin is probably not necessarily healthy. But we know that there is a weight for each of us because of our height, because of our family history, because of our ethnic background, that there is a weight that is appropriate for the height. So we need to know what that is, right? We know what we're aiming for, either to gain weight or to reduce our weight to get to that goal. So obtaining and maintaining optimum weight is very important. As we get older, it is actually important to have a little extra. Yay! Right? I'm so glad I'm over 60. Right. So, there's excuse, right? And why? Because as we get older and maybe more prone to have problems or disease states, then we need to make sure that if we are ill, we don't lose too much weight. So we need that little bit of cushion. Low sodium diet. Now, why would I say that? Well, it turns out that salt, sodium, actually creates problems and causes high blood pressure. It may even cause hypertension. Because of the way our body handles salt and because very, very powerful chemicals excreted that we'll talk about a little bit when we talk about medications, sodium plays a big role in maintaining a normal blood pressure. We need to keep it low. Do we have to cut it out? Well, no. If you don't have problems with your blood pressure, a little bit of salt is very tasty. But there are other things that we can use that are just as tasty. Lots of herbs, fresh or otherwise, but a lot of different things we can use to substitute for salt. Unfortunately, many of the fast foods we rely on are high in salt. Many of the sodas we drink are higher in salt. Many of the potato chips, some of the things that are already salted and we know are obviously definitely high salt. So we want to maintain a reasonable salt intake and make sure that if we have hypertension, it's lower. Regular physical activity. I resisted putting exercise here because I think sometimes exercise has a bad name and we get a little bit uncomfortable thinking about it because it sounds like something we have to do in addition to our very busy lives. But regular physical activity could be walking the campus here at Oberry. It could be walking up the steps at our job, wherever it is, instead of taking the elevator. It could be parking further away, unless it's at night, at Walmart, and then walking. It could be any number of things that we do. It could be tending our garden or going to a dance. Wonderful activity. Or it could be, anything that we do for exercise. We like that. Golf, swimming, thing that keeps us active and off our seats. And that's really extremely healthy for us. The studies that have been done about physical exercise show that actually it's the small increments. Remember when I talked about just a little bit of weight?